Palpating the anterior portion of the knee, first we have the patella, which is a large sesamoid bone, also known as the kneecap. Next, we're going to palpate the trochlear groove. So the trochlear groove is the tract where the patella slides medially and laterally, and this is how you palpate it. Next, we're going to palpate the quadricep muscles. The first one's going to be the rectus femoris. It's going to originate at the AIIS. The next one, vastus medialis, is going to originate at the medial lip of the linea aspera. The next is the vastus lateralis. It's going to originate at the lateral lip of the linea aspera, the greater trochanter, and the gluteal tuberosity. Next, the vastus intermedialis is inferior of the rectus femoris, so that's going to originate at the anterior and lateral shaft of the femur. These quadricep muscles are going to all insert at the tibial tuberosity, which is this bony prominence below the kneecap. So these quadricep muscles are all going to merge and form the quadriceps tendon. Last, we have the patellar tendon, which is below the kneecap and above the tibial tuberosity.
So first we're going to do the medial knee palpations. So first is the meniscal windows. So if you go find the patella tendon and go laterally on both sides from there, it'll be the two indentions on the sides. And next is the joint line. So if you go medially and laterally, run your thumbs across from those meniscal windows, you will find the joint line of the knee. Next is the medial tibial plateau. So if you find that medial meniscal window and go distally a little bit, you'll feel that tibial plateau. Next is the tibial tubercle or the tibial tuberosity. So if you go from that tibial plateau go laterally, you'll find a bump right here, and that's your tibial tubercle or tuberosity. Next is the medial femoral condyle. And if you find that medial meniscal window again, and if you go proximally, you'll feel a bump there, and that's your medial femoral condyle. And if you go proximally again a little bit, you'll find that epicondyle, the medial femoral epicondyle. And then go a little bit medially and posteriorly, you'll find the adductor tubercle from there. And it's like a big bump. Okay. Next is the MCL. So once again, you're going to find that meniscal window, the medial side. And if you go from, it attaches to the medial meniscus. So you're going to go in there, and then you're going to run your finger or your thumb posteriorly, and it's not really palpable, so I'm just showing you the general region of it. Next is the medial meniscus, which is found inside that medial meniscal window. And then the pes anserine, if you go distally from there, that's the attachment side of the pes anserine. We'll be doing the lateral knee palpations. So we're going to start with the lateral tibial plateau. So you're going to find the meniscal window, and it's going to be right before the bump. And that bump is going to be the lateral tubercle. The lateral femoral condyle we can find by going a little bit laterally, and it's going to be a bump right there on the side. And if we go a little bit more laterally, we can find the lateral femoral epicondyle. And the head of the fibula, we're going to come down to the lower leg, and there's going to be another bump right here. And the lateral meniscus we will find by going into that meniscal window again, and on the lateral side. The lateral collateral ligament, we would have our patient go into a figure 4 stretch, and it's going to be a cord-like structure on the lateral side. The biceps femoris tendon, we'll have our patient roll over onto their stomach, and it's best felt when resisting knee flexion, and it's going to be the cord-like structure right here. The IT band, we can have our patient roll over onto their side, and we can feel it. It's going to be a thick fascia right here, and that will insert into the Gerdy's tubercle. The common peroneal nerve, we can feel on the head of the fibula near the neck, and it's going to be another thick cord-like structure.
I'm doing the posterior palpations of the knee. The knee is slightly bent. In this space right here is the popliteal fossa. It also can do a diamond. Inside the popliteal fossa is the popliteal artery. Knee straight, we're going to find the biceps femoris muscle, which originates on the ischial tuberosity, and that's a long head, and the short head is on the lateral lip of the linea aspera. Then we have the semimembranosus, which originates on the ischial tuberosity and inserts on the posterior aspect of the medial condyle at the tibia. Then we have the semitendinosus, which originates on the ischial tuberosity and inserts on the proximal medial shaft of the tibia at the pes anserine tendon attachment site. Then we have the lateral head of the gastrocnemius and the medial head of the gastrocnemius.